From her days as San Francisco's district attorney to her current role as Vice President of the United States, many have noticed changes in Kamala Harris's appearance over the years. Today, we'll explore her journey, examining whether these changes are a result of natural aging, makeup techniques, or perhaps even plastic surgery. All estimated costs are revealed later on, so make sure to stick around until the end of the video. In 2001, at the age of 37, what I'm seeing here is that Kamala has a prominent widow's peak. That's the area right here at the center of the hairline. In some people, the center is not as pronounced, and it might look like the center is just in line with the rest of the hairline. But in others, it looks more like the center has its own prominence where there's an extension down towards the rest of the forehead. And we see this phenomenon in both men and women. I'm noticing that there are some signs of brow descent in this photo, especially when you compare back to her teenage years. And we know that there are signs of aging that can be seen in all of us in as early as our late 20s. And especially as we hit our 30s, we start to see parts of the face starting to descend. Kamala has good medial cheek volume, and she has less of that cheek volume the more lateral you move along the zygomatic arch. When she smiles, you have nearly full upper tooth show visible, and her Cupid's bow is quite well defined. But in contrast to the Cupid's bow, the actual philtral columns are less defined. Kamala also has a strong chin, and you'll see why that's relevant later on in this video. In 2003, at the age of 39, what you see here is good supratarsal show with some lateral upper eyelid hooding. And this is related to that lateral brow descent that we talked about previously. As the eyebrow, especially the lateral portion, starts to gradually droop, it brings the upper eyelid with it. And what that creates is increased eyelid hooding. Sometimes it's the skin itself that's starting to stretch out. But in these earlier years, it's more that the lateral eyebrow is starting to slowly droop. I'm also seeing a scar on the right lateral orbital rim. It's unclear what might have caused this, but there is that small scar there, and we'll see it present in later years as well. And now in her late 30s, you're starting to see some lower facial laxity. The ligaments of the face will gradually loosen, and you can see that starting to happen here. In 2004, at the age of 40, what we see here is under eye hollowing, and that is sometimes referred to as a tear trough. Now that is in part caused by some of the fat content in this area starting to slowly diminish. And what that leads to is a distinction between the actual lower eyelid and the cheek itself. Some will look to correct this with fillers, while others might get a lower blepharoplasty to reduce that distinction between those two areas. But that is a delicate area, and it must be handled with care. And in this profile view, what I'm seeing is some minor nasal convexity. And what that really means is an upper nasal hump. It's rather small in Kamala's case, and it's not too obvious, but it is there, and I think it brings some nice naturality to the area. Some people look to reduce that hump as part of a rhinoplasty, while other people get rhinoplasty surgery for, say, the tip of their nose, but they actually don't want the hump addressed because they feel that it connects them to their roots, to their culture, and just gives them that distinctive appearance. So everyone has a different opinion on how they feel about their hump. Personally, I'm very happy with my nasal hump. In 2005, at the age of 41, that scar that I mentioned previously is more visible in these images. Scars on the face can be addressed in different ways. Sometimes people go for laser resurfacing, that can help, but you have to be sure that the type of laser is properly picked to match the skin type of the person. Also, the depth of the scar might change your treatment of choice. Other times, when the scar is too wide or too deep, we might address it with a surgical excision and revision of that area. Other techniques for scar could include microneedling, and some people are even applying exosomes topically to help with improving the quality of the scar. Sometimes in more delicate parts of the face, we might employ fat transfer techniques where we benefit from the stem cells that are in the fat to help rejuvenate the quality of the skin, in addition to allowing the filler component of the fat to improve the contour of that scarred region. In 2006, at the age of 42, I see no change. And in 2007, at the age of 43, what we see here are those natural forehead rhytids or wrinkles. They're running perpendicular to the actual fibers of the forehead muscle called the frontalis muscle. Some people end up getting Botox or other neurotoxins to reduce the appearance of those wrinkles or to sometimes eliminate them. But as you introduce neurotoxin to the forehead muscle, you have to keep in mind that that's the only muscle that actually lifts the eyebrows. So if you go to paralyze it, that might actually weaken the eyebrows, giving you some brow descent or ptosis. And for some people, they rather not have the brows descend down, so they avoid the frontalis, and other people will actually inject smaller doses to the forehead to try to not paralyze it too much. But sometimes that can have a paradoxical type of effect in that you'll try to work harder to raise those eyebrows, and in so doing, you actually create more wrinkles. So there is some controversy on whether or not the frontalis muscle should be treated with neurotoxin. And that discussion came up in my podcast with Dr. Doris Day. So if you're interested in learning more about that, make sure to check out our podcast. In 2008, at the age of 44, when you look at the midface, you can see that there are some signs of general volume depletion. Remember that the two main ways that we show aging in the face is first the descent of the tissues, and that has to do with gravity, of course, and the second is volume depletion, as we lose those qualities to our skin, to the muscle, to the bone, that at a younger age gives us that vitality. As we grow older, the integrity of those tissues starts to weaken. And you can see that Kamala has upper tooth show on repose. So when she just parts her lips like this, you can see some upper teeth. And that gives off the appearance of a more youthful face. In 2009, at the age of 45, I'm seeing that Kamala is starting to overline her upper lip with makeup. When you compare back to 2001, her upper lip looks a bit fuller, but I think this is less likely to be filler based on some of her more recent photos. I think instead of filler, she just chose to use makeup to overline that upper lip and give the appearance of a fuller, taller upper lip instead of going the route of filler. As you know from my other videos, a lip lift can also increase the overall volume of the upper lip. In 2010, at the age of 46, what I see here is that Kamala has these horizontal neck rhytids or wrinkles forming in the neck. This is sometimes improved with a facelift procedure, but usually it doesn't completely get rid of these horizontal lines. Some people are just more prone to getting them, and one approach to help reduce the depth of those lines is the use of filler. But no matter what technique you use, those lines are difficult to completely resolve. And just like we talked about the horizontal wrinkles of the forehead being formed perpendicular to the fibers of the frontalis muscle, so too when you look at the neck and you look at the fibers of the platysma muscle, these horizontal wrinkles are running perpendicular to that neck muscle. In 2011, at the age of 47, I'm seeing some signs here of potential veneers. This is a very common procedure to help correct some dental imperfections and to also give a different coloration to the teeth themselves. In 2012, at the age of 48, what I wanted to point out here is Kamala's excellent skin quality. Remember that the darker one's skin is, the more melanin it contains. Melanin in turn protects us from harmful UV radiation. That leads to fewer wrinkles and improved overall skin quality. But no matter how much melanin someone has, sun protection is still very important. And great skincare is also very important. And for the best skincare products, make sure to check out are Feel Confident products. In 2013, at the age of 49, I see no change. In 2014, at the age of 50, when I look at Kamala's left eyebrow, what I see is that the body and the tail of the brow don't have much hair. She may be using makeup or microblading to help recreate the appearance of a fuller brow. Some people also get eyebrow hair extensions or, in some cases, eyebrow hair transplants to bring hair back to the eyebrows. And when I look back at her photos, it looks like at least since 2001, there's been a hair deficiency in that area. Now, this could be from several different potential causes. One is just not being born with much hair in the mid to lateral eyebrow. Some people get eyebrow alopecia from overplucking, while others might experience some traumatic event like a deep cut on the eyebrow that then leaves them with some hair loss. Yet other people have some thyroid deficiencies that might lead to a thinner eyebrow. And conditions like mine, alopecia areata, can also sometimes affect the eyebrows. There are also some scarring alopecias like frontal fibrosing alopecia that leads to the hairline getting higher as well as the eyebrows thinning. In 2015, at the age of 51, I see no change. And in 2016, at the age of 52, I also see no change. In 2017, at the age of 53, what we see when we look at Kamala's forehead is that the rhytids or the wrinkles are now becoming more static. So previously, they were just there when she animated or like say raised her eyebrows. Now we're seeing more of those wrinkles at rest. And that's what happens over time. Eventually those lines get etched in. And in Kamala's case, I still see no signs of a facelift procedure. Her sideburns are still present. The tragus looks very natural and does not look modified. And she has jowling and neck laxity that seems to be increasing. In 2018, at the age of 54, I see no change. In 2019, at the age of 55, what I'm seeing here is that there's nasal ptosis when she smiles, and this is often absent after rhinoplasty. When a rhinoplasty is performed, oftentimes the nasal cartilages are locked in and they're sutured together in a way that the nose no longer moves when you smile. But when someone has not had a rhinoplasty, you see these natural changes like this small droop of the nose when she smiles. And remember, when you're comparing the nose from one year to another, you have to see if the patient is smiling or are they not smiling. When we smile, our nose widens. That's a very normal type of effect. Also, depending on how close we are to the camera itself, the nose might appear bigger as we get closer or smaller as we move further away. And that again is a normal phenomenon and something that needs to be looked at closely when you're trying to figure out, has someone had a rhinoplasty or not? I'm also seeing here that Kamala's crow's feet wrinkles are now more pronounced. And I wanted to point out here, going back to what I mentioned early in this video, that her strong chin has been, I think, somewhat protective against more advanced tissue descent or the appearance of more aging in the neck and in the lower face. Our underlying bony anatomy matters for how we age. The weaker the bony anatomy, the less likely it is to support our tissues and the more likely they are to droop faster and for more laxity to develop. And the sooner then we would show our signs of aging. In 2020, at the age of 56, I see no change, and that's the same through 2024. The total cost of these potential cosmetic procedures is $50,000. Do you agree with this analysis, or do you think that Kamala Harris has had more cosmetic procedures? Comment below. Let me know which celebrity or politician I should cover next. And don't forget to feel confident.